Hello, everyone. My name is Anjana Marella, and I'm presenting my project about COVID-19 compliance and transmission in U.S. cities under the guidance of my mentor, Jacqueline Aramco. I chose to research this topic because COVID-19 changed the way we live, learn, and connect, and I wanted to understand why the same virus has such different effects in different communities. Today, I'm presenting from Dublin, California, and I'm excited to share what I discovered. COVID-19 wasn't just a health problem, it was a test of how much we trust each other, how well we communicate, and how communities work together. Imagine three cities facing the same storm, a virus that spreads quickly, overwhelms hospitals, and disrupts daily life, but each reacts differently. Today, I'll show what happened in California and what it can teach us for the future. Not every city followed the same playbook. Officials gave rules, but the real question is, did people follow them? Research shows even small changes, like more people wearing masks, can make a huge difference in slowing the virus. For example, in some areas, 80% of people wore masks consistently, and cases dropped sharply. In others, only half of the people wore masks, and hospitals quickly filled up. Why does such a small change matter so much? Because viruses multiply exponentially. So even a few more people following rules can save hundreds or thousands of lives. I collected data to see how behavior matched the rules. From mask wearing to vaccine uptake, testing, and social distancing, I tracked what people actually did and then compared it to how the virus spread. The results were eye-opening. In neighborhoods where people were careful, wearing masks, avoiding large gatherings, and getting vaccinated, cases stayed low. But in places where even small rules were ignored, the virus spread rapidly. This shows that what people do every day really shapes outcomes. The simulation made one thing clear. Rules alone don't stop a virus. When people trusted health messages and worked together, cases went down. When trust disappeared, compliance fell, and the virus ran wild. Trust disappeared when messages were inconsistent or misinformation was spread. People didn't know who to listen to, and they started making choices that put themselves and others at risk. Here's what actually happened. San Diego acted early and kept following the rules, so hospitalization stayed low. Los Angeles had big surges because it's so crowded, even with mandates. Sacramento, where few people followed the rules, saw the virus spread quickly. Same virus, different outcomes, all because of people's choices. So, what's the takeaway? Rules aren't enough. The real game changer is human behavior, how communities act together when it matters most. Social pressure, cultural habits, and misinformation all influence behavior. Understanding and guiding these behaviors can save lives in ways rules alone can't. Why does this matter? Government policies give structure, but trust and clear communication turn rules into action. Educating people, being transparent, and involving communities before a crisis is the key to handling future pandemics. For example, cities with strong community health programs could quickly educate citizens, resulting in higher compliance and fewer cases. Investing in public trust today makes everyone safer tomorrow. Cities with higher compliance controlled COVID-19 more effectively. Rules helped, but trust, communication, and cooperation made the real difference. We must be transparent, involve trusted leaders, share clear messages, highlight collective benefits, and engage communities. Science gives us the tools, but trust and teamwork make them work. Together, we can save lives and stop future pandemics faster. Thank you for listening.